Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. My first question to you today. So COVID-19 vaccine rollout will ramp up from this week. We've been told that more than 100 fixed sites and mobile teams will be administering first and second doses of the vaccine. Would you be able to just give us a little bit idea of some of the more prominent site locations? And then further, could you remind us of the protocol for the vaccination and who can take it now?
Well, we have vaccination sites in every region. So what we have done is that we have created some fixed sites, meaning that you can go there any day and there would be vaccination teams that would be working there. So in every region we have created fixed sites, and we have widely publicized where those sites are in the region. And then we have mobile teams. So those mobile teams would be moving from community to community, getting persons in those communities to come out and get their vaccination. And with those mobile sites, we have been partnering with a number of organizations. You would have noticed that in the past week or so, we have done some partnerships with CIOG, the Presbyterian Church, the Guyana Hindu Dharmic Sabha. So these are some of the organizations that we have been partnering with because they help us to mobilize and organize within the community. So when we go there, people are already aware and people would come out and get their vaccines. So we are happy to extend that partnership, and if there are other groups who would want to work with us, they can reach out to us at the ministry so that we can make those arrangements. I know there are lots of service organizations like the Rotary and Lions, and we would be happy to partner with them so that we can roll this out into communities and do it as effectively and efficiently as possible.
All right, the follow-up question was the protocols. Have we completed the frontline healthcare workers and moving into the other category?
Well, it's a rolling exercise, so we haven't completed per se any single category, with the exception that all the healthcare workers in Region 9, at least in the public sector, have received their immunization. And in different regions, healthcare workers are at different percentages. So I think that's an ongoing kind of exercise. And in terms of, as you would know, that initially we had said 60 years and above, we haven't exhausted that 60 years category. But now that we have lowered the age to 40 years and above, it means that anybody 40 years and above can come to any one of the vaccination sites and get their vaccine. One of the complaints that, as I told you before, that we had received is there have been some people interpreting 40 years and above to mean just people who are 40 years. That's not the case. The above mean anybody who is older than 40 years should be able to receive your vaccine. So if you are 60 years and you didn't get your vaccine for whatever reason during the first period when we had prioritized this, then you can come now. There's nothing stopping you from coming now to get your vaccine. So that's it's a simple protocol. So anyone who falls within this age category should come out and get their vaccines.
Okay, sir. All right. The ministry's target of administering about 40,000 first dose of the vaccine this week. How confident are you that we will be able to achieve this?
I'm very confident because our teams have been training. We have lots of people now who are available to us. And in addition to that, we have been assigned, or the Army has assigned 400 persons to work along with the vaccination team. So these persons are going to enhance the work that we do. Some of them might be helping with the documentation, and there are different roles that they will play. So we are very happy to have them on board. This certainly has expanded our workforce, and therefore, with the amount of people that we now have, I think we can easily achieve that. Of course, all of this, while we can prepare and have everything ready, all of this is, dependent on how people turn out. And so I want to really encourage people to come out and get their vaccines. As you know, vaccines are important. They help to protect you, and they can save your life. So if you have the opportunity, you fall within the category to receive the vaccine, please do not hesitate. Just come out and get your vaccine.
All right, two follow-ups I have with what you just mentioned. I understand, well, initially when we had spoken, you had made it very clear that no one will be forced to take the vaccine. But I understand there's some concerns with what is being called the anti-vaxxer stance that some people are taking. So if you can address that for me. And then after that, the training for the Sputnik V specifically.
So in every country and globally, there are a set of people who, for whatever reason, they're against vaccination. And from time to time, they would create campaigns and try to get people not to take their vaccines. Now, they might have their reason why they're doing that, but certainly it's not helpful in a pandemic, because we know that the vaccines that have been developed to prevent COVID-19 are very effective. One of the things that these anti-vaxxers have been saying is that these vaccines have not been tested properly. Well, these vaccines are the most tested vaccines in the history of the world, because apart from the clinical trials that they've gone through, as it is now, millions of people across the globe have received different types of vaccines. So those that are made in China, you have more than 100 million Chinese who would have received these vaccines. Similarly, the vaccines that were made in Russia, millions of people would have taken these vaccines. The ones like Moderna and Pfizer's vaccine, again, millions of people have taken these vaccines. So if there was any concern about the safety of these vaccines, we would have already seen any adverse reaction, because now it's a larger pool of people that have taken these vaccines. There haven't really been any adverse reaction. So these vaccines are really safe. Now, apart from the concerns that people might have had with the safety, which has now been proven that they're all very safe vaccines, some people wonder about the protective effects of these vaccines. Again, we have seen that these vaccines are protective because they prevent people from getting the more severe form of the disease. So you would recall that some people might get a mild infection, some might get a moderate infection, some might get severe infection. Now, if you get mild infection, you literally can isolate at home, and then after 10 days, you're back out to work because you're non-infectious. If you get moderate to severe infections, then you probably would need hospitalization if it's moderate, because you have difficulty breathing, and that can then easily transition to being more severe, where you really have to be assisted in breathing with one of the different breathing apparatuses that we have. So whether it's a CPAP machine or a ventilator, you would need to go on one of those. So, and we have seen that those people who really get severely infected, a percentage of them will die. Now, these vaccines help to prevent that from happening. So we'll see less patients, first of all, having the need to be hospitalized, less patients then transitioning into needing the ICU, and less patients dying. So if you have something that is going to protect you from dying, why not take it? And that's what I want to appeal to people to understand. So You might have persons for whatever reason that they don't want it. Well, that's fine. If they don't want it, we're not forcing anybody to take it. But what they should do is not try to dissuade others for whom this vaccine could mean life and death, not to take it. So I hope people in their own minds would go through the safety profile of any one of the vaccines that we are giving. That information is readily made available to people who want to have it. And when you come for your vaccine, whatever vaccine you're being given, we explain to you how that vaccine works and so forth, give you all the information that you need. So I do hope that people come forward and get their vaccines. In Guyana right now, we have more than 42,000 or so persons who would have already gotten their first dose. And if you have any doubt and you know someone who have taken their vaccines, ask them, talk to them, ask them how they feel, if it was a difficult process, if they had any side effects, talk to them so that you can get an understanding from someone who took the vaccine and not someone who, don't like vaccines. So talk to people, and I'm sure when they speak to the persons who have received the vaccines, they would get a better picture, and perhaps that would convince them to take the vaccine. Here in Guyana also, you have seen some of the more prominent physicians in the country stepping forward to take the vaccines. So if they had this disbelief that vaccine did not work, they wouldn't have come and take it. They have a lot of medical knowledge. They, more than anybody, understand how these vaccines work and everything. And they have so much confidence in the vaccine that when we start giving the first 3,000 doses, they were the first in line to take it. So they were leading by example. And I really hope that people can understand these things, look at the examples that the healthcare workers have been giving, the doctors especially have been giving, and ensure that you take your vaccine. And if you have any doubt, the team at any one of the vaccination centers would be able to explain the use of these vaccines, the type of vaccine, and anything that you need pertaining to these vaccines. So I would really want people to come forward and get their vaccines, because we know that these vaccines, they work. They work very well at protecting people, preventing them from getting the most severe form of the infection, preventing people from dying. And of course, that's what we want to do. We want to protect people, save lives.
Yes, sir. All right. I wanted to ask you about the training for the Sputnik V.
We have conducted training for the Sputnik V. So a lot of the teams now are fully acquainted. There are some special arrangements that we had to put in place because these vaccines have to be stored at a particular temperature, and that is why we had to do extra training with the healthcare workers. That training has been completed, so we have trained teams to go to every region, and they would start rolling out that vaccine as of today.
All right, thank you, sir. I wanted to touch on the total, the numbers now. The total number of deaths from the pandemic thus far in Ghana is about 247. And I'm asking this question. We know a lot of why it's happening. We've spoken about that repeatedly. Do you believe with the rollout of an even more robust vaccination campaign that this can help to curb, of course, with people taking the necessary precautions?
We can reduce deaths, we can reduce hospitalization if a lot of people take their vaccines. That has been shown around the world because we have seen in countries where they have high rates of immunization that the cases have dropped, hospitalization have dropped. Our challenge, however, would be that how fast we roll this out and how quick people take the vaccines. And that is why we need to get everybody on board to make sure that they take the vaccines. We have seen in Guyana, and we have been warning over the last couple of weeks, because we have seen an uptick in the amount of hospitalization that we are getting. We have also seen that we are now getting quite a number of persons in the ICU. As of today, we have about 14 persons in the ICU. And unfortunately, these are our sickest patients that we have, in the system. And unfortunately, some of them, we lose them. But if we take vaccines early enough, a lot of this would be prevented. So I really want to urge people that if you have an opportunity to get your vaccines, please go and get your vaccine, because it can protect you.
All right, Minister, thank you so much for speaking with us today.
Well, thank you very much. There's just one clarification, because earlier you mentioned that we'll be doing the second dose and the thing. So what I just want to say to people is not that you're getting your first dose and second dose at the same time. There are persons who we have already administered the first dose to, right? And their second dose is now becoming due, especially those persons who have received the Sinopharm vaccine. Their 28 days are up, or most of them would start getting close to that 28 days. So for the persons who have received Sinopharm vaccines, we want them to check their cards to see when their dates are going to be due, and for them to come back to get that second dose. And for those persons who have received the AstraZeneca vaccine, we are operating with that 8 weeks to 12 weeks window so as to boost the efficacy of the vaccine. And again, for those persons who have received their vaccines earlier, for them to check and see when they're due for their second dose, and to come to get those second dose. So when we talk about the doses, right, we mean that those who have already gotten their first dose, they can present themselves to get the second dose once the time is due. And for those who are now coming for the first time, you will be getting your first dose now.
Okay.
All right?
All right, thank you so much for that clarification. All right, well, that's it for today's COVID-19 update. We just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.